mechanical heart valve replacement is on warfarin. He is admitted with pneumonia and started on erythromycin. A few days later, he develops severe nosebleeds. What is the mechanism of this interaction? A. Erythromycin induces CYP450, decreases warfarin levels. B. Erythromycin inhibits CYP3A4, increases warfarin levels. C. Erythromycin enhances renal clearance of warfarin. D. No clinically relevant interaction. Answer B. Explanation. Erythromycin inhibits CYP3A4, decreasing warfarin metabolism, higher INR, and bleeding risk. Q2. A patient with epilepsy on valproic acid presents with drowsiness after starting aspirin for pain. Which mechanism explains this? A. Aspirin induces glucuronidation of valproate. B. Aspirin displaces valproate from plasma proteins. C. Aspirin increases renal elimination of valproate. D. Aspirin decreases valproate absorption. Answer B. Explanation. Aspirin displaces valproic acid from albumin binding, higher free levels, CNS toxicity. Number 2. Hospital pharmacy Q3. A nurse administered vincristine intrathecally instead of intravenously. The patient died within hours. How is this classified? A. Type B adverse drug reaction. B. Sentinel event, catastrophic medication error. C. Phase 4 pharmacovigilance report. D. Therapeutic failure. Answer B. Explanation. Vincristine must never be given intrathecally. Wrong route administration with death equals sentinel event. Q4. During aseptic compounding, a pharmacist notes that a cytotoxic drug vial has a cracked seal. What is the most appropriate immediate step? A. Use the vial with extra precautions. B. Discard the vial as hazardous waste. C. Store separately for future use. D. Autoclave before using. Answer B. Explanation. Damaged cytotoxic containers pose contamination risk, must be discarded in hazardous waste. Number 3. Community pharmacy Q5. A 4.5-year-old patient asks for OTC ibuprofen for back pain. He is also on lisinopril for hypertension. What is the risk? A. Severe hypoglycemia. B. Acute kidney injury due to reduced renal perfusion. C. Hyperthyroidism. D. Reduced risk of GI bleeding. Explanation. NSAIDs plus ACE inhibitors reduce renal perfusion, increased risk of acute kidney injury. Q6. A teenager collapses in the pharmacy with seizures. His friend reports he overdosed on isoniazid tablets. What is the antidote? A. Naloxone. B. Pyridoxine, vitamin B6. C. Atropine D, flumazenil. Answer B. Explanation. INH toxicity causes seizures by depleting pyridoxine, treated with IV pyridoxine. Number 4. Pharmacotherapeutics, Q7. A cancer patient on cisplatin develops severe hearing loss. What is the mechanism of this adverse effect? A. Cochlear hair cell apoptosis due to oxidative stress. B. Neurotransmitter blockade in auditory nerve. C. Increased cerebrospinal fluid pressure. D. Vasodilation of inner ear vessels. Answer A. Explanation. Cisplatin causes ototoxicity via oxidative damage to cochlear hair cells. Q8. A patient with resistant hypertension is prescribed minoxidil. 1 month later, he presents with swollen ankles, tachycardia, and pericardial effusion. What explains this? A. Minoxidil activates K-pi channels, reflex sympathetic stimulation, and fluid retention. B. Minoxidil inhibits renin, volume overload. C. Minoxidil causes pulmonary hypertension. D. Random unrelated adverse event. Answer A. Explanation. Minoxidil is a potent vasodilator, reflex tachycardia plus fluid retention, managed with diuretic beta blocker. Number 5. Regulatory guidelines. Q9. A new oncology drug is being tested in a phase 2 clinical trial. Which of the following is the primary objective? A. Large-scale efficacy and safety comparison. B. Dose-ranging study to assess efficacy in patients. C. Initial human safety in healthy volunteers. D. Post-marketing surveillance. Answer B. Explanation. Phase 2 determines efficacy, optimal dose, and short-term safety in patients. Q10. A generic company submits an ANDA for a drug. Which of the following is not required? A. Bioequivalence data. B. Preclinical animal studies. C. Cmax and AUC comparisons. D. Evidence of same dosage form and strength. Explanation. ANDA bypasses animal and clinical efficacy studies. Only bioequivalence is required. That's